name is I'm a clinical psychologist, and today I'm going to talk about cognitive therapy, behavioral cognitive therapy. And this is a therapy technique that can be used for all psychological disorders, and my hope with this series of videos is that you will be able to use some of the principles to get a lot better. If you try these principles, they will work. They will make your life better, get you more in control of your feelings, and you might need to go to a therapist too, but you can get a long way by trying out these simple techniques. First of all, the basis for cognitive behavioral therapy is that the way we think influences the way we feel. You can have a very good day and then suddenly you get a phone call about an accident that has happened to one of your family members and you feel extremely bad. Okay, 2 minutes later you get another phone call with an excuse. No, there was a confusion of identity. It wasn't your family member who had been hurt. And whew, you feel very relieved. So nothing has happened in the outer world. It's just that you've been thinking that somebody you love has been hurt, and then you think that this somebody is safe after all. And your feelings go in the direction of the thoughts. So it is quite obvious that what we think about influences the way we feel. We don't react to the real world, what happens in the real world, but we react to what we think about the happenings in the real world. A very typical example is saying hello to a patient. As a psychologist, I'm not really allowed to say hello to a patient unless we have decided in advance that this is okay. I will in a way give away the patient if I say hello. Everybody will understand that this is one of my patients. So imagine the situation where I haven't discussed this with the patient, but I don't take the risk of saying hello. I meet the patient in a shopping mall, and to keep confidentiality, I just stare straight ahead and I don't say hello to the patient. If the patient doesn't know that I do this to protect his or her confidentiality, they can be very hurt. They can think, I'm just interested when I pay for my consultations. He's not really interested in me, etc., etc. And could have a devastating effect on their self-image. Whereas, imagine the patient that knows that this is the case, that psychologists are not allowed to say hello to their parents, to the patients, then this will be quite okay. It won't be a problem at all. Actually, one of my patients, she praised me for not saying hello. She said, "You were so professional." So the way she thought about the situation, the way she interpreted the situation, made all the difference. So, in other words, we can work with our thoughts. And when we can change our thoughts, the way we interpret what happens to us, then we change our feelings. And then the anxiety can go away and the depression goes away. So this is the first and basic lesson of cognitive therapy, is that it's the way you think about things that make you react to them, not the things in themselves. Okay, so now we're going to go on with several other videos about cognitive therapy, which are more of a practical nature, more techniques.